trying to move your voice.
I've got a call.
Welcome to Hull Island Reports. Content warning, this episode contains discussion of so-called conversion therapy. At 10 AM on the 23rd of March, that's this coming Saturday if you're listening at time of release, there is a noise demo being organised by Transaction Block, Lesbians and Gays Support the Migrants and the Dyke Project at 30 Euston Square in London. The nearest tube stations are Euston and Euston Square, but do be aware that there may be a counter demonstration by some fascists, so be safe and arrive with some caution. This demo is in protest of a group called the Clinical Advisory Network on Sex and Gender, or CAN-SG if you don't have the time to say all that, which is holding a conference entitled Do No Harm at the Royal College of GP's headquarters. Tab's call-out describes CAN-SG as a far-right anti-trans medical lobby, who advocate against prescribing hormones and lobby doctors to deny trans youth the healthcare they want and need. Dr. Ruth Pierce, in a blog post from the 3rd of March, describes CAN-SG's keynote speaker, Ritiketu Kaltiala, as a clinician and opponent of affirmative care who contributed evidence for Florida's ban on medical transition for young trans people. Kaltiala's work is also cited in documents that informed the Cass Review. The findings of this review are being used by the political class as justification for withholding trans healthcare, particularly to minors, in favour of convincing trans people that they aren't in fact trans. Other speakers at this Do No Harm event are equally as shit, with Stella O'Malley, the founder of anti-transition and anti-trans healthcare group GenSpect, as well as other members being in attendance. Just to cap off the lowlights of speakers, there's Professor of Sociology Michael Biggs, who, among more serious publications about how he believes transgenderism is a thing, also posts tweets under a pseudonym, such as, quote, "Transphobia is a word created by fascists and used by cowards to manipulate morons." Nice guy. With CAN-SG lining up a who's who of so-called medical professionals who'd rather see us dead than happy, the Royal College of GPs received a large backlash for letting their head office be used for this conference. In a statement, the RCGP said that this space is run by an independent events company, but also that the RCGP would be at risk of breaching the Equality Act if they cancelled the event, and as such, the RCGP has reached the decision that the CAN-SG conference can go ahead. Interesting contradiction, they simultaneously don't control who uses their building, but also do control who uses their building, and it's CAN-SG, they're letting CAN-SG use it. In one self-contradictory statement, trans kids are thrown to the wolves by the RCGP, and the CAN-SG conference will go ahead. With a large amount of the prospective speakers coming from anti-trans healthcare and trans conversion therapy groups, and because I procrastinated getting this interview out until I finally realised that it's relevant to this demo, this episode of HIR is an interview with Dr. Joe Hartland. They worked in the NHS for 5 years before leaving, were the lead author of the Association of LGBTQ+ Doctors and Dentists so-called Conversion Therapy Medical Schools Charter, and now teaches at Bristol Medical School. We talked about their experience of working within the NHS, the steps Joe has taken to change medical education for the better, and fighting so-called conversion therapy from within the medical profession. Before the interview, again, it's 10 AM on the 23rd of March, 30 Euston Square, London. Wear a mask, bring some water, and make some fucking noise. Joe Hartland.
The NHS is a pretty unique place to work. The reasons that I left were sort of relatively, I want to say complex, but that's probably the wrong word because they're not really complex. It was to do with the working conditions. But the balance of that with my mental health and physical health was not a great fit for me, despite the fact that I loved medicine and I certainly I was sort of working within or looking towards working within palliative care. So a lot of my work had been with people who were dying, because in medicine, as soon as you become known for being interested in something on the general wards, that's kind of what you end up doing, especially if you happen to be good at it. And I enjoyed it. Like it was really great. But I think probably if I'd stayed in the NHS, I would be dead today. my mental health was very bad, and the working conditions of the NHS didn't really allow for compassion towards staff. And I still don't think they do. I think it's much worse, actually. So yeah, that was kind of my experience of working in the NHS, was that I think it, as an employer, lacked compassion towards its staff.
As a queer person, were there any experiences within being employed by the NHS that sort of stood out to you from a queer perspective?
I think that's an interesting question, because a lot of my so I didn't come out as genderqueer until about 2 years ago. I kind of did that typical, went into the lockdown as one gender, came out as another, or rejecting the concept of gender. And whilst I think the lockdown and kind of being single and having, time for self was actually a big part of that journey. I think the other thing was that leaving the NHS allowed me to kind of reclaim part of my self that I'd had to compartmentalize for the sake of this idea of professionalism, what is and isn't accepted within spaces. And that kind of motivates me in a lot of the work that I do now, and kind of some of the research that I'm doing to try and work towards a PhD is around the idea of how does the idea of professionalism, or what is put out as the ideal of professionalism, act as a gatekeeping device for people from marginalized communities. So whilst I was out as gay, whilst I was in the NHS, I really feel like I was detached from part of myself and felt unable to explore and express that. And I think if we look at the British Medical Association's 2023 report into LGBTQ plus doctors and medical students, we can see that reflected in the culture of that report, especially in regards to gender. Medicine as a career and as a topic is fairly conservative. A lot of my work focuses on how we need to improve undergraduate teaching of medicine in the UK. And undergraduate curriculums in the UK have been designed to serve a set bit of the population, and that set bit of the population is overwhelmingly cisgendered, male, straight, white, and able-bodied. Everything else is sort of pathologized from that point. And so one of the things that I'm trying to do with my work is think about how we represent the voices of people who have been traditionally missing from medicine. As a result of those people being missing from the education, there is a lack of appreciation for those people's experiences. So I think queer people's identities are quite lost, and they're often compartmentalized. They're often seen through a lens of whiteness, through a lens of being kind of cis and gay. That's often how queer people are thought of. And very little thought is given to health beyond sexual health, which is vital and important and not done particularly well. But often, the questions that you'll see where queer people are represented in exams will be centered on white cis gay men with HIV. That tends to be where it stops. And not only is that unfair to the rest of the community, it also promotes a culture of stigma, because the way in which that conversation of HIV is handled is not handled well. So, sex positivity is not within the curriculums. We don't really talk about what it means for people to be, coming and getting regular checkups. Like I remember explicitly as a medical student having my first experience of a sexual health clinic as a student, as a professional, I guess. And overwhelmingly, the queer community were coming in being like, I'm here for my regular checkup. This is really, kind of proactively looking after themselves. And the straight community came in and were like, there's pus coming out. And there was a real difference in the approach to how their health was thought about and how they were kind of proactively looking after their sexual health. And yet we don't see that reflected in the curriculum. It's still done through a lens of moralism, and sex is very moralized. And I think for me, one of the things that I've tried to push towards seeing more in healthcare is the idea of joy and thinking about what it means to promote good health, not just kind of like prevent bad health. And I think this is especially important for kind of trans siblings who are accessing healthcare, because a lot of the time we focus on the idea of the treatment of dysphoria. And that's fine. Dysphoria is a horrible thing to be experiencing. But really, the goal of treatment should be gender euphoria. It should be making patients not just not unhappy, but it should be making them happy. It should be about achieving good physical and mental health for those people. And yet within the queer community, our health is not seen through that lens. It's very much seen through the lens of trauma and minimizing trauma. And often that trauma is created by society and by the Society of Medicine as well.
No, that's really interesting. I guess I've never really considered like that disparity between the way sort of queer people are portrayed in terms of sexual health versus how proactive a lot of queer people are. Yeah. In terms of educating more around joy and euphoria, and like medicine for being healthy, how does that manifest in a curriculum? Is it, I don't know, I'm kind of imagining like rewording exam questions, but I assume it goes a lot further than that. How does it sort of manifest in that way?
Yeah, I mean, you're right. Rewording exam questions is a big part of that. We know that assessments drive learning, right? So if your assessments aren't reflecting the content of your curriculum, then you've done a bad job of either one or the other. So you have to have that alignment. But so for me, I think a big part of it is co-producing with the people who are affected by it. So whatever health inequity or inequalities you're looking at, you need to be having the voices of the community who are affected as part of that, and inviting them in, paying people for their time, ensuring that they feel welcomed and valued for their contributions to the curriculum is part of how you start to cement joy. And I think the other thing is, a lot of the time, some of my colleagues will be saying things like, but I need to teach about this. I need to teach about this risk that this community have. Right, that's fine. Teach about the risk, but just think about the phrasing of it. How do you discuss the idea of sex? Is it through this kind of moralistic lens? Or do we think of it through a different perspective? So the example of, if they really want to just keep it to a white cis gay man going to a clinic for HIV, does it have to be this lengthy description of how much sex this person has had with lots of different people? Or can it just be that he is going in for his, 3-monthly checkup, that he is on PrEP, that he has been proactively kind of looking after his health and has been looking out for any signs of infection that he may need to attend earlier? And yes, he may have had unprotected sex within that, but we don't write it through a lens of judging people. Because there is that implied hidden curriculum, the messages that we send to students through the things that we include and don't include in the curriculum. So there's a lot around the messaging and the wording. And then I think the other thing is around not only asking people to help co-produce content, but bringing them into classrooms to share their stories. And if I think about my experience at medical school, like, we did touch on some issues related to inequalities and thinking about diversity. But like, if I'm honest, I think probably I was taught how to be racist, for instance, or how to be homophobic, because we just heard the bad examples. We were never taught how to not be racist, how to be anti-racist. We were never taught how to not be homophobic, right? We weren't taught about how to include and welcome and value that community. We were just given the examples of when it looks bad. And if you're only given bad examples, you know what not to do, but you don't know what to do. And so I think we have to move, and this applies to kind of all ED&I work, I think, personally, across multiple sectors. We have to stop focusing exclusively on bad examples. And if we do use those, we have to be talking about what should have happened instead of what did happen. Because otherwise we're not teaching people, we're just kind of slapping them on the wrist and saying, isn't this bad? And that's true, but it's not going to go anywhere towards education.
That's sort of very valuable, I think, with sort of the legacy of the NHS and its perhaps slightly up and down healthcare record. I think that's very valuable. I just wanted to move to your work on conversion therapy. As it's called. You were the lead author on the medical school charter. How did you? I mean, I read a little bit about it, but how did you sort of get into campaigning against conversion therapy? At what point, and what sort of what triggered you into it?
I always find this. It's a good question. I just find it very strange because I can remember very specifically what got me into it, and it's because I think it was 2021 or late 2020. There was a meeting of the British Medical Association in which some members put forward a proposal that the BMA would support a campaign to ban conversion therapy, or so-called conversion therapy, in the UK. And a third of people attending, so a third of the doctors attending, voted against that motion, so against the BMA supporting a ban. And I was just filled with rage at that. And disgust at my colleagues for whatever their reason taking that stance, and for people actively standing up in that room and speaking out against that motion, which was put forward by a BMA representative called Emma, who's excellent. And I was just sitting there thinking, like, that cannot be right. We cannot have a third of our profession holding that view. And my remit is schools. You know, I work within medical schools for the last 5-6 years, and I do that nationally and locally within the Bristol. And I thought, you know, that's the area I know. And so I worked with Bridget and Callum to start authoring this document. And what I wanted to do was to say, look, the teaching of medicine is an evidence-based thing. We teach from a place of evidence. The evidence against so-called conversion therapy for both gender and sexuality is overwhelming. There are global calls for a ban on all forms of conversion therapy. The definitions of conversion therapy are broad but well understood. And kind of off that basis, to go to medical schools and say, is this not a responsibility for us? If we can see the prevalence of this issue in the UK, if we know that 19% of people who've had so-called conversion therapy in the UK think it has come from a healthcare practitioner, is it not our responsibility to be ensuring that we are including this in our curriculums, and within that outlining other forms of good practice for LGBTQ plus inclusion? And then I kind of had to find a way for that to sit with a group who were not associated with a medical school or a kind of organization that felt like it would have some sort of political identity within it. And GLAD, the Association of LGBTQ plus Doctors and Dentists, were very amazing at taking that on. And Duncan, who I work with at GLAD, has been a star in kind of making sure it's being campaigned and pushed. And so they held they were the owners then of the project, so that we had an external group who could kind of be the forward-facing aspect of it.
What has the reception been from medical schools to that charter?
Mixed, I think, is safe to say. I hesitate to say too much because we still have some schools that haven't signed, and it's still my hope that we will get those final 8 on board. I think that we have across the years encountered hesitancy due to the inclusion of gender within our charter, driven by the wider conversation that we see in politics around that, and an anxiety around whether there's an evidence base for that. And I feel confident there is an evidence base for including that. Religion has played a small part in it as well. So the conflict between religious identities and a banning of so-called conversion therapy, and perhaps a lack of understanding about its impact and what it is, and the belief that some people hold that it is illegal and they didn't realize that it wasn't. So a lack of awareness about the issue have all been things that we've encountered. But we've also encountered schools that have just embrace this fully, have been early adopters who are already doing work on it. So I've seen people from across the spectrum of responses, from kind of not engaging at all to actively contacting us and seeking us out so that they can sign up and ensure that they are doing their part. And I think for a lot of schools, there's a worry about, our universities or our medical schools campaigning institutes, should they be supporting this sort of thing? And my feeling on that is that, of course, they should, because there's a clear evidence base behind it, and medical schools produce evidence. We are research institutes. And therefore, if the evidence is clear, medical schools should back it. We should have confidence in the global evidence base. So it's been a mixed bag, but there have been some very positive responses in there as well.
That's good about the positive responses. What do you think would have to change to get? I know that's a very nebulous question, but in order, for other medical schools to get on side, how would the world look in order for all of those medical schools to be signed up?
That's a good question. I don't know if I know. I think one of the things that has to change is the dialogue around trans people and the idea of a gender ideology, and the idea that in some way the provision of healthcare for trans people when it comes to gender affirming care is in some way associated with conversion therapy in itself. Due to the topic being so politicized, I think that particular institutions are anxious about engaging with it from an institutional risk perspective. And I think that's one of our biggest barriers, is that the politics at the moment are scaring people away from being part of the conversation, which I don't think is acceptable. Just because I can see where it's coming from doesn't necessarily mean I agree with it, but it is what it is. I can't, there's a limit to how much we can realistically change all in one go.
Yeah. I don't want to keep you too much longer. I just wanted to ask about, Kemi Badenoch's comments in the Commons, sort of equating trans healthcare with conversion therapy. You've already spoken about it a little, but just tell me about. I assume there's no evidence base for that position. So I don't know. Just tell me about your thoughts on almost your work and your campaigning almost being sort of politicized in that way and weaponized.
Yeah, I think the important thing is that to start with is that the reason that the Conservative Party and the Labour Party as well, to be fair, are taking this stance is because this is well-funded hate groups who are engaging with those parties, and selling a political standpoint that they hope will win them votes. That's all it is. They don't particularly care about the rights of women. They don't particularly care about the rights of queer people. None of that is the driving cause. And so just from the standpoint of what are the foundations of these arguments, the foundations of these arguments are power and the retention of power and the selfish pursuit of it. It's nothing to do with the well-being of any group, no matter what they say. Same can be said for those people who are making careers out of being cancelled for their views. There is no evidence to back up those claims that trans healthcare is a form of conversion therapy. The premise of that statement is that it is possible to convert someone to be trans or to be not trans. And the premise of my document that I've worked on with others has been that we don't believe that is possible, that people have an innate sense of themselves, and that may change over time with different understandings of themselves, but that the forceful changing of somebody from one thing to another is not something that can or should be done. And a lot of conversion therapy evidence shows that, the idea that you can convert somebody from being gay to straight is well documented, that it fails, as it does when it comes to trying to change someone's gender or trying to cure them of being trans. And I think the really important thing is that a lot of these conversations treat the idea of being trans or genderqueer or non-binary or whatever, wherever you fall within that spectrum of identities, it treats it as some sort of social contagion, which is a disease, something that can be picked up and transmitted. Ultimately, the concept that trans healthcare, the provision of gender-affirming care, is a form of conversion therapy, is designed entirely to remove access to trans healthcare, not to end conversion therapy. It has two separate goals. And that's most obvious in the fact that if gender affirming care is a form of conversion therapy, then why do we provide gender affirming care for cis men and women all the time on the NHS? Because if it was, then we should be removing that as well. So the argument is a fallacy. It's grounded in no science and the desire for power.
That's interesting, sort of that argument being founded upon the idea that conversion therapy works, I suppose is an angle that I didn't consider too much. No, that's really interesting. What are you doing now in terms of research and educating? What is the future look like for you?
So within Bristol, I'm working on kind of so I'm doing something called working towards a PhD through publication, which means that I'm doing small pieces of research that I'm trying to get published to build a body of evidence to be able to go, hey, I'd quite like a PhD. Because I can't afford the time or money to do it full time. So a lot of my research is going to be looking at kind of the identities of marginalized people in healthcare, especially from the professionalism aspect. So a lot of my work will be around that, and queer identity is going to be a big part of that, but also the intersection of race and religion and everything else with under that umbrella, because I want it to be intersectional in the approach that we take. Otherwise, we exclude a big part of our community. And then nationally, I continue my work with the Medical Schools Council. I sit on the executive board of the Equality, Diversity and Inclusion Alliance, which is a great group that's working towards improving the inclusion and experiences for students across curriculums in the UK. And then for the charter, I think we are exploring avenues to work with external groups to see if we can get those final schools signed up. and we will do our best to do that. I think part of me wonders how successful we will be in that. And I think it's perhaps what we need to do is empower students and staff at those universities to take those conversations to themselves, because it's quite a lot for external groups to be doing that, as along with everything else that, you know, we have in our lives going on. And if those schools choose to be on the wrong side of history, then, well, that's just another sad story in the history of medicine, choosing to be on the wrong side of history. But I hope they don't. I hope they see it and understand the value of it, and they think that this is something that they want to be part of. So we'll kind of have to wait and see how that plays out. But yeah, we'll give it another final push to see what can be achieved.
Thank you to Joe for taking the time to speak to the podcast. You can follow them on Twitter at Hartland Joseph. That's HARTLAND JOSEPH. The music for this episode is Mindbreak.018M by Free99 on Bandcamp, Twitter, and Newgrounds. Saturday 23rd, 30 Euston Square. Tab's full call-out will be linked in the episode notes. Mask, water, noise. More reports to follow.